Welcome to the Practice of Medicine podcast from the Southern Medical Association. Since 1906, SMA has had a singular mission to provide medical professionals with the resources they need to learn from each other and in doing so, improve the overall quality of patient care. The Practice of Medicine podcast is just one of the ways we do that, as we discuss a wide range of topics including multidisciplinary approaches to patient care and new innovations in medical technology. To learn more about SMA's many other services and educational initiatives, please visit us at sma.org.
Today we are joined by Ryan Alexander, a fourth-year medical student at the University of South Carolina School of Medicine, and Dr. Donald DiPette, the Health Sciences Distinguished Professor at the University of South Carolina, South Carolina School of Medicine in Columbia. Ryan has been interviewing for internal medicine residencies and is sharing his perspective and insight about the interview process during the COVID-19 pandemic. Thank you both so much for being here today.
Thank you, ma'am. It's a pleasure and an honor to be talking with you guys today.
Oh, absolutely, Jennifer. And I want to extend a gracious thank you to the SMA for giving Ryan and also myself indirectly a forum to really address and talk about extraordinarily unusual circumstances and how we can learn from them, both the positives and the negatives, and move forward, clearly, hopefully even when the pandemic is over.
Well, thank you both, and I'm really looking forward to having this conversation with both of you. Ryan, let's just get started. What do you think the interview format is going to look like in years to come? You've been interviewing virtually, so as we look ahead, do you think we will return to in-person? Will it stay virtual, or do you think there might be a hybrid model?
Yes, ma'am. So I think even before the pandemic, I know some of the internal medicine, especially the residency programs, have been considering either some component of virtual interviewing. And I think in the future, the ease of being able to see these programs virtually, do it at home, not have all the cost and associated inconvenience with travel and things like that. I think in the future they will retain a virtual component for the interviewing process and maybe seeing some of the school. But I think that missing the in-person component of meeting the people, seeing the facilities, and really getting a feel for the culture and camaraderie, that is an essential component that I think we lack this year, and I hope in the future they can retain in some capacity, whether that's a hybrid model or maybe being able to interact with the top schools of your choice to see them in person. I hope at least that component is retained in the future.
Dr. DiPette, do you have any thoughts?
Yeah, I would agree with what Ryan said, Jennifer. You know, there's really always a positive, and positive aspects to come out of everything or anything that's catastrophic, such as this pandemic. We are going to, I'm sure, discuss some of the positive aspects of Ryan's experience, as well as some of the negatives. But just like in patient care, where it's turned its patient care on its head, and we're using more virtual telemedicine, phone connectivity with patient, appointments and engagements. I think we're going to see the same thing in residency or even perhaps even medical school student application interviews and the interview process. And I welcome that.
Based on feedback they had received regarding the maldistribution of residency interview invitations, the Association of American Medical Colleges, the AAMC, has offered programs, institutions, and students some recommendations to take, where appropriate, to help ensure successful matches. Among these suggestions, program directors could interview and rank enough candidates to create a successful rank list and rank them as they have similar candidates who have matched into that program in previous years. For student affairs officers and advisors, advise all students about this year's unique challenges with interviews and encourage those with more interviews than needed to perhaps release them to allow other students an opportunity to be invited to interview. For students, the AAMC also suggests to them releasing some additional interviews if they are not needed, allowing fellow students interview opportunities. With that said, what are your thoughts on the AAMC's announcement regarding residency interview allocation?
Yes, ma'am. So, the trend this year that was kind of made aware to us in that statement by the AAMC was that because of the kind of ease of interviewing virtually, they had noticed a trend that in ophthalmology, for example, I heard that 60 to 70% of the interviews were occupied by 25% of the applicants. And so the top tier applicants were able to um, maybe keep and perform more interviews than they would have been able to in a regular year where they wouldn't have been able to travel to all these places. And so it's made a very anxiety provoking year for a lot of middle tier applicants because they're not getting a lot of interviews and they're not feeling as comfortable about their ability to match. And so the AMC recommended that any students that were kind of having an abundance of interviews consider dropping those that you may not need to kind of serve your peers and give them a chance to um, interview as well.
So maybe if
Yeah,
there was
Jennifer,
one you weren't, oh, I'm sorry, go ahead, Dr. DiPette.
no,
Oh, I was just going to say, so if there was one that you might not have been as interested in, normally maybe give that slot to one of your colleagues, to one of your fellow interviewees.
Yes, ma'am. Like kind of try to narrow your selection as well as you can. And if there's something that you're not extremely strongly considering, maybe uh, consider dropping that to let someone else have a chance.
Jennifer, this is one of, I think, one of the negative unintended consequences of the COVID pandemic and shifting the vast majority, if not all, of the interview process virtually. As a senior member of the faculty and former dean, this one troubles me. And I think it's worth a lot more discussion. And I applaud the AAMC for, number one, picking up on the data very, very quickly, and also providing this statement and making this announcement. It's also happening on the other side. I've talked to residency program directors and associate program directors, not only at our institution, but others, and they also are being overwhelmed by the interview process because there's been, as Ryan stated and the AAMC made perfectly clear, there's been a lot more interviews per applicant this year because of the virtual nature of the process. And again, this is it was unintended. It's a speed bump, but I am concerned about this, and I do not want to be exclusive. We always want to be inclusive of the process.
As we continue talking about the process, do you think that match week and the match process will differ at all this year? For example, the fourth round of the supplemental offer and acceptance program, or SOAP, has been added.
Yes, ma'am. I think that it kind of transitions smoothly. I think that might be a kind of unintended side effect of uh, the interview allocation arrangement because now there's more of these maybe like quote unquote middle tier students that in a normal year would have 11 interviews, this year have 5. They might be there might be more individuals soaping and more reliant on it, which is gonna, I feel like, cause match week to be very anxiety producing as well. Um, so it should be, and the aspect of that, and then not having a lot of like an ability to do an in-person match day celebration. That's usually like one of the kind of highest points of our medical school career, and having to maybe do that virtually or like or not at all with your family or friends is going to be very kind of disappointing, and it saddens me a little if it's already going to be anxiety for producing for these students trying to catch soap, and then we also can't have in-person celebrations. It's a little disheartening for me about match week, but I'm still so excited for the process. But those aspects are a little disappointing to me.
We've talked kind of broadly about the process. So let's talk just a minute about the more specifics of your experience. What were some of the components of a virtual interview day and happy hour? Did those differ in a lot of ways from an in-person experience?
Yes, ma'am. So the virtual happy hour was the night before the interview day. It was a substitute for when you would usually go to like the interview day dinner with the residents and the faculty, which from what I've heard is like one of the highlights of the whole experience. And because you get to meet and interact with everyone outside of the medical capacity and kind of see what they're like as people. So that's what they tried to stimulate with these happy hours, and it was usually you and just residents. Sometimes there would be faculty, but usually just residents. And it was very relaxed. They encouraged you to like drink beer if you wanted to or eat, and you just got to know them and the program. And then the next day was virtual interview day. I think the programs did an incredibly great job of cutting down the Zoom interview day to only the essential components because they realized they could put a lot of more information on their websites about like their match lists, their curriculum, all of that could. They got really great and flexible about putting all that information online. So they really made the interview day very efficient. It would be like a 1 hour presentation by the program director, and then like your 2 or 3 interviews and some time to meet with the residents. And then maybe they would have you with noon conference or morning report so you could see what the academic side of the program is, which was really helpful. So I think they just did an incredible job of tailoring it to us and kind of adapting. And that made this interview process much smoother for me.
Jennifer, I wanted to second what Ryan just said. This was another aspect of the virtual interview process that concerned me, but more importantly, other faculty, particularly faculty that are interlinked with the application process. As Ryan said, I have heard repeatedly from students, not only this year but past years, that the evening before, the dinner before, or whatever the get together was for individual programs, that actually was not only the highlight of the program, but was one of the most informative for them because, as Ryan said, it was relaxed. Most programs only had residents interact with the students as opposed to faculty, although that's certainly okay to have faculty as well. And I was worried that losing that would be a major negative for the student to understand the program, get exposed to the ambiance of the program, if you will, and the milieu of the program. But what Brian said is what I've also heard other student applicants say, was that the programs did as good a job as they could, and we'll even use the word tremendous job to try to supplement that and make up for that. I was less worried about the actual interview day as I was about the pre-interview engagement, but that also went very well according to other students that I've interacted and talked with. And again, kudos to not only the students for pursuing this with an open mind, with a positive attitude, but also kudos to the program administration of each of these residencies. This was not easy, by no means.
Ryan, as you went through the virtual process, did it help with any nervousness you might have had? Did you feel that piece of it being virtual may have helped, or did it make you more nervous?
I think it was less anxiety producing for me because you could have like the comfort of being in your own home. But I think that with that, it kind of like, I feel like the in person, you have more of you might have a little more anxiety, but you also have kind of the emotional highs of being there. I think, sorry, I think you had another question, didn't you?
Oh, no, just if it made you more nervous, less nervous, or if it really didn't have an effect. And I think you answered that very, very nicely.
Okay.
We've touched on some potential drawbacks of this whole process, but in your opinion, were there advantages to interviewing virtually? I think we've touched on that a bit as well. But maybe you could tell us more if there were other ways that this was actually good.
Yes, ma'am. I think there are definite positives to this process, at least in my opinion. First, I think so while students may have applied and interviewed at more places, I think what it allowed me to do is evaluate places I might not have either considered physically or for other reasons. Like, for example, I interviewed at two schools in Texas that I may not have applied to or even been willing to go to physically in another interview year. And those were two of my like most favorite experiences. So it kind of uh, it opened the door, I feel like, to kind of widening your wings. And then I would say that the cost savings is such a positive for me. Um, ha- Normal in a normal year, you would be either driving to these places, flying to them, booking hotels overnight, consuming all the meals in that process. I mean, that could be 10 grand for some people, and a lot of individuals like can't take that along with the normal med school tuition and paying for standardized tests and things like that. So I think the cost savings is a very strong benefit from the med student perspective.
Dr. DiPette, do you have any thoughts on the potential advantages of this virtual process?
Well, clearly, Jeff, Jennifer, the major advantage that I've heard over and over again is what Ryan said, and that is the reduction in cost of the interview process was very, very important. And I think that's one lesson that I think we possibly can learn as faculty and administrators and and program directors and leaders, not only medical schools but the individual departments and programs. The student loan is getting to be so large and so enormous. Of course, you read this over and over and over again, but it's very difficult to address. And I think it's a strong negative. We're trying. This helped. This really did help. And I think it allowed some students that otherwise would not be able to afford to reach out to a broader net, if you will, of programs, as Ryan suggested. It gave them the opportunity to do that. So I think that that's a good thing. And that's something I think we want to take with us post-COVID when we're back to some new normal, if you will. So we can maybe do a hybrid model has been talked about. I know we might be talking about that a little bit later, so that we can allow students that otherwise have really significant financial limitations to equally be able to throw a broader net whether it's a larger number of programs. I don't necessarily mean it means that, but it might be a broader net with the same number of programs, but just maybe more distant programs outside of a regional aspect, if you will, a more national net, if you will.
We've touched on potential drawbacks as well as we've been discussing this. So specifically, what have you seen as additional drawbacks? And if you can provide a little detail on that, I think everyone would be interested in hearing your thoughts on maybe some of the negatives of this process.
Yes, ma'am. I think we kind of mentioned it before, but I think the strongest thing that you're lacking with the virtual interview experience is that personal experience and seeing what the people and the culture and the camaraderie are like, and whether I think I could see myself fitting in with these people and growing and succeeding with them for the next 3 years, because these are going to be my friends and colleagues. And um, meeting them in the virtual environment is great. I think you can still get a sense of that with the residents' virtual happy hours. You can kind of see how well do they interact with each other. Are they joking, or is it more kind of serious and it doesn't seem like they know each other at a personal level? But I think that aspect is one that is kind of disappointing to be missing. That's what I would say the main disadvantage is.
Jennifer, I agree. Just like we said, that the overwhelming positive lesson that we've learned has been the financial benefit of doing virtual interviews. This is clearly the opposite and really the greatest negative. There is no substitute for human to human contact, in person in-person discussions, private or in groups, and walking the hallways of institutions, seeing the facilities, listening to the environment around you. We just can't substitute that. We can try, and we have tried, and I think we've done as good a job as we could this year. But again, there's no substitute for that.
Once the interview process is over and you've completed all of your interviews, what are the standards in terms of post-interview communication?
Yes, ma'am. So I can at least speak from the internal medicine point of view. The AAIM has came out and basically said that you don't need to engage in post-interview communication either on the student or the school perspective. And the schools actually kind of, from their perspective, would rather not hear from you because it puts them in a challenging position of they want to respond, they want to show you they're interested, but they can't tell you too much or be too biased because they have to. The NRMP is kind of monitoring that. So I think some other residencies I've heard of my classmates sending thank you letters, and schools have still sent us some really like heartwarming care packages or like thank you letters, or little small like coffee cups, tokens of like kind of gratitude for interviewing and considering them, which really was very well received in my opinion, and I really appreciate them kind of doing something like that.
So Jennifer, this is something that's interesting to me. I'm old enough to have seen this come full circle. We were taught always, write a thank you note, communicate back to individual programs, or no matter what the visit's for. Of course, we're centering this on residency application visits, if you will. But I think we're moving again in a right direction and minimizing this. One would think it would be cordial. One would think that it would be positive behavior, et cetera, between individuals, programs, and applicants. But not all applicants know to do this or have done this, et cetera. So I guess in the issue of fairness and also in the issue of putting one, whether it's the student or the program, in an untenable or an uneasy position, I think we're moving in the right direction where it is not. It's not to be dismissed, if you will. One can still do it, but there are programs that actually are starting to say, let's not do this at all. Ryan, is that something you found?
Yeah, I wanted to make a comment about that. The idea of fairness has been really emphasized this interview season, and I have really, really appreciated that. Exactly what you're talking about. It's more that they don't want like communication that blurs the lines or that people can misinterpret if they said like we really do want you to come here. It's just trying to keep everything fair. Another thing I've really appreciated I've seen in interviews with that aspect is some schools have had maybe like one or two standardized interview questions to remove kind of bias and in the interview process. So they ask those questions to every student. And so those might have been like teamwork or equity or communication skills or something like that. But I did appreciate that aspect. And another school told me that they blocked out the images of the students on the applications when they were evaluated to consider for an interview. So I think bias and fairness and those aspects are really being emphasized, and that I think that's wonderful to see as a student going through this.
Yeah, I would strongly second that, Jennifer. We are trying our best. I think we're moving in the right direction. We still have a long way to go around these issues.
You both have brought up some very interesting points, and maybe Dr. DiPette, I can start with you on this. What do you see going forward with the process? I know we touched on this a bit in the beginning, but do you think we will continue with virtual or at least a hybrid type model once the pandemic is over, or where at least in-person interviews could be an option, do you think we will shift back to that model, something different?
As I mentioned previously in the podcast, Jennifer, we're learning a lot, and we're learning a lot of change in the positive manner as well, including, as I mentioned, patient care interactions, being more virtual, more telemedicine, more by phone, et cetera. I would like to think that we are going to see more of that. I think we're going to see, and I would like to hope we would see that there'd be a broader format of interview process, or formats, if you will, to individual applicants from the programs. I can't promise that. Of course, we're still right smack in the middle of the pandemic. But when we come out at the end of this, I think it would be very important for leadership, program leadership, deans, if you will, hospital leadership, to come together and really discuss the lessons learned from the 1.5 or 2 years, if you will, if it goes that long. And I would really like to see the interview process tailored more specifically to the individual applicant, if possible. It's not one size fits all, and it never should have been. On the other hand, we never knew to do something different. And there's books about change, and organizational change has to start with a burning platform as the impetus for change. And boy, the COVID-19 pandemic was the burning platform. So I'm hoping for positive change in the future. I would like to see a hybrid model. I still would like to see most applicants be able to interview in person. That's just a personal, maybe older fashioned belief, but I also strongly recommend that we extend a hybrid model in virtual interviewing, or even maybe a combination of both, to broaden the applicant experience, and also broaden the applicant ability to interview at programs that otherwise they might not be able to, for financial or time or whatever reason.
Yeah, I cannot express how wonderful, like the vision that Dr. DiPette is, the picture he's painting, how, at least as someone who hasn't experienced the format before, that combination of being able to go there in person and see that aspect, and then also being able to have the ease, a little bit of the cost saving, make it more fair and more dynamic and flexible. I think it would be a wonderful, wonderful route, in my opinion, in the future.
We've talked about so many different aspects of the interview process, especially in the middle of a pandemic. Ryan, what is your overall impression, when it's all said and done, of interviewing in the middle of something as big as a global event like a pandemic?
Yes, ma'am. I think initially we were all a little hesitant and really uncertain about what this interview season was going to look like. But I think after going through it and trying to take a step back, I cannot express to you how thankful I am of the programs for being so flexible, so dynamic, still providing us with a lot of the information and the feel of what it would be like to be at that program. That is so challenging to express just through a PowerPoints and a video screen, and they've done such a wonderful job. I think I was speaking with some classmates the other evening, and the one thing that we have realized recently, as we're kind of concluding the interview process and getting near the rank list process, is I think the reality of maybe making your list and going to one of these places when you match in March has a little trouble setting in for us, because we haven't gone to these places in person. I think that would make the decision and the choice a little more concrete. It might be a bad analogy, but if you're just seeing these schools through a video screen, it's like I just played a game, and now I need to make a choice about really going to these places, and I've just been here the whole time. So that part is a little strange for us, but I think we'll come to adapt and still make a wonderful decision and have bright futures.
I would also like to turn that around a little bit. Ryan was gracious enough to compliment and acknowledge what the programs did for the students, but I cannot tell you, again, as a more senior leader and a previous dean of our School of Medicine here, how proud I am of our students and our student body, not only with the interview application process, but our first and second year students that, education's been turned upside down in terms of, virtual lectures, classrooms, test taking, et cetera. The patient care aspect's been turned upside down. The interview process and the discussion we're having today is just one microcosm of all the changes that we've faced, that we've conquered on some, and some we've done well, and some we still have lots to learn about. But the students, and again the faculty as well, but I'm talking about the students now. I can't tell you how impressed, how proud, and how warm I feel now about medicine. I always have been positive. I'm a glass half full person, but this has only renewed my faith, my spirit, my excitement, enthusiasm for the young learners, whether they're students today, residents tomorrow, junior faculty the next day. We're in a great position. These individuals, these men and women are phenomenal, and I'll leave it at that.
We hope you enjoyed the practice of medicine. For more episodes in this series or SMA's The Business of Medicine podcast, go to sma.org/podcast or subscribe to us on iTunes, Google Play, Spotify, or wherever you get your podcasts. For more information about SMA's mission, please visit sma.org, and thank you for joining us today.